We've been following the global birth rate trends, and I am on team Let the Birth Rate Plummet to Hell. So let's now talk about Singapore. This article from Newsweek that came out last week says Singapore gets bad news amid sinking birth rate. Singapore's labor force has shrunk for the third consecutive year as its population ages amid a falling birth rate, prompting the government to urge employers to diversify their hiring and retain more older workers. The proportion of Singapore's residents aged 15 and over participating in the labor force dipped slightly to 68.2% this year, down from 68.6% in 2023, according to the latest report from the City-States Ministry of Manpower, MOM. Officials attributed the decline to the rising number of seniors. Whilst the labor force participation rate remains high, it has declined for the third year in a row due to a rising proportion of seniors, the ministry said in a statement on November 28th. As the workforce continues to get older, ongoing efforts to enhance the employment and employability of senior workers are more important than ever. While labor force numbers have declined slightly, the employment rate among Singaporeans over 15 remains robust compared with other major cities, the ministry noted. For comparison, New York City's labor force participation rate stood at 61.2% in October, according to the U.S. Bureau of Labor Statistics. The ministry noted that workforce participation among Singaporeans aged 55 and older has increased, citing initiatives to boost seniors' employability. However, those aged 65 and above exceeded 19% of the population in 2023. And by 2030, that figure is projected to reach 24%, according to data from the UN's International Labour Organization, putting Singapore on track to being a super-aged society like Japan. This demographic shift has seen Singapore's elderly support ratio drop, just 4 residents aged 20 to 64 for every elderly person compared with 6 in 2014. Singapore, like the United Nations, measures total fertility rate as the average number of births a woman is expected to have over her lifetime, based on current fertility rates for women of reproductive age. Official statistics show the city-state's TFR stood at 0.97, so less than 1 child per woman last year, a decline from 1.04 in 2022. The figure is comparable to other highly urbanized populations in East Asia. China stands at 1, Japan 1.2, Taiwan at 0.87, and remains far below the replacement rate of 2.1 needed to sustain a population. The slowing resident population growth and aging of our population will lead to tightening manpower constraints in the medium term, the ministry warned, adding that it will support career transitions into more productive and higher paying jobs while calling for openness to foreign workers in direct investment. Singapore's technological edge may help soften the impact of its demographic pinch. So, after years of being a homogeneous society, like many of these Asian countries are, they're going to start welcoming some foreign workers. So that is a shift that many of these countries are seeing. So while our country is demonizing immigrants, other countries know and understand that they will have to start allowing them in. So it's definitely an interesting shift to watch. Singapore ranks second globally in robot density after South Korea, boasting 770 industrial robots per 10,000 workers, according to the International Federation of Robotics, which lauded the city for its high ranking despite its size and small manufacturing industry. And I do believe that we are moving to a world that will have to have robots, because otherwise, how are these older folks going to be taken care of? I don't know. But women are not going to have babies simply to take care of older folks. They're going to have to come up with some other talking point other than that. Now let's shift over to Europe. So this is another article from Newsweek because, many of these countries in whole areas are facing this population decline. So let's talk about this one, Europe's population crisis. Next year is the last year that Europe's population is set to grow, as it is expected to start declining in 2026, with just 1 in 25 people living in the EU by the turn of the century, statisticians say. Ahead of the new year, Newsweek has spoken to two experts to break down some of the reasons for the population decline in one of America's greatest allies, some of its fallout consequences, and whether it can be reversed. Europe is forecasted to continue growing, albeit slowly, until 2026, when its population will peak at 453.3 million, according to Eurostat, the statistical office of the European Union, before it falls to 419.5 million by 2100. This, along with the faster growing populations in other countries, means the EU will only account for 4.1% of the global population by that point, Eurostat said in its baseline projections released this past July. In developed countries, an average of 2.1 live births per woman is considered the threshold needed to replace the population, but European women have an average of 1.52 children. This excludes the impact of migration, which was the driving force behind the 1.7% population growth that Europe experienced between 2013 and 2023. Shrinking workforce. As Europe's population gets older, the number of working age people is declining. This means fewer people contributing to the economy through the private sector, but also through taxes, which are needed to fund the pension and health needs of the growing elderly population. The shrinking share of the working age population is called the demographic burden, according to Population Europe, a network of the continent's leading demographic research centers. This could have a negative impact on the standard of living measured as GDP per capita, the network says, citing a 2014 study published in the Journal of Economic and Human Geography. Europe's aging population poses less economic risk than feared if productivity driven by education and labor force participation are accounted for. Dr. Theodore D. Cosco, a research fellow at the University of Oxford Institute of Population Aging, told Newsweek. Policies that increase workforce engagement, particularly among women and older adults, he added. Similarly, demographer Anne Goujon, PhD, who heads the International Institute for Applied System Analysis, Population, and Just Societies program, told Newsweek that many parameters could help in mitigating the impact of decline. Increase in labor force participation, particularly of women, increase in levels of education, increase in the age at retirement and training over the life course, were some examples she and the researchers Guillaume Maroy cited. Immigration has long been a mitigator of Europe's declining population, but immigration in the way it is currently taking place is not enough to offset the decline of Europe's population effectively, experts say. Immigration under pressure. In countries in Eastern Europe where the population is declining the fastest, it is largely due to immigration, Goujon said. In the receiving countries, some may still see a small increase, especially those with high levels of immigration, such as UK, France, or Sweden, while others may see more or less a marked decline. Overall, the sustained levels of immigration able to compensate for the decline in population would be too substantial. Goujon argued that Germany is a case study for this. Like many other European countries, Germany's fertility rate was below 1.5 live births per woman in 2022, according to Eurostat. But its population has not dipped as much as Lithuania, for example, because the former is receiving more migrants while the latter is suffering immigration. The high immigration rates explain why in some of the receiving countries where fertility is also low, the population is not declining as much. Cosco said that while attracting well-educated, well-integrated migrants may be able to offset some of these challenges, high immigration without proper integration or education selection may increase dependency. A focus on education, strategic migration, and effective labor policies may be able to provide and sustain economic stability despite demographic shifts. Cosco cited a 2020 study called Population Aging, Migration, and Productivity in Europe, which concluded either increased immigration or alternatively efforts to increase fertility have been suggested by different sides of the political spectrum as possible policies to counteract population aging. But Neither of these two strategies pursued within realistic bounds have had as much impact as possible changes in labor force participation, improving educational attainment, and better economic integration of immigrants. Can Europe reverse demographic slide? Costco said it's hard to say whether Europe's population decline could be reversed, arguing that mitigation strategies should be the focus. Gujan said she thought a reverse was unlikely. Support to increase fertility has so far been only effective at the margin or not effective at all, she said. Migration can help momentarily, but in order to compensate for a declining workforce, a country needs to have a constant flow of migrants as migrants age or return to their host country as they age. So the thing that we're seeing consistently is many of these xenophobic or, their nationality focused countries are having issues because they are so xenophobic or only focused on their particular culture. They are racist to a point. So immigration is key, but so many of these people are so antagonistic towards the other population, especially darker hued populations, that they know that they need these people, but the fact that they're racist won't allow them to allow these people in. So it is going to be very interesting to watch. They can't make these women have babies. So they're going to have to decide, are they going to keep being antagonistic towards women and reducing women's rights? Or are they going to allow immigrants to come in despite the fact that they don't really like darker hued immigrants? It's a conundrum for many of these countries, so we'll see how that goes. Remember, I'm on team let the birth rate plummet to hell. Let me know. Are you on the same team? Or are you on team have some babies and stuff? Join the conversation. Don't forget to like, comment, and share. And if you're not yet following me, go ahead and smash the follow button.